when a Chinese medicine doctor looks at you and evaluates you, they are taking into account your body, your mind, and your spirit. And when all of these parts of you are addressed and balanced, that's when you're in a state of health. So the idea is that you have chi or life force flowing through your body, and when this life force is flowing uninterrupted, then you are in a state of health. What happens when you have chi stagnation is that's when you get pathology. So there's a 1,500-year-old saying in Chinese medicine, if the channels are free, there is no pain. If the channels are obstructed, there is pain. An obstruction of chi flow through the meridians leads to stagnation. So it's a really easy idea. What do you feel like when you look at this? When you're stuck in traffic, when you're stuck on the freeway, you get tense, your neck gets tight, your back starts to hurt, you get irritable. And the idea with acupuncture and opening those channels and moving your chi flow is that you end up with this. You know, this is a whole different feeling when you look at it. Things are moving freely, things are moving unobstructed. This is a representation of the 12 main meridians. They're distributed on both sides, but every one of these lines connects to one of your organs. So you have a heart meridian and a stomach meridian and a liver meridian, and all these little dots on these lines are acupuncture points that have indications not just for your physical self, but for your mental self and your spiritual self too. So that is how we know when you come to us and present with different symptoms, that's how we decide where to put the needles. So in Chinese medicine, what we are aiming to do is to restore balance to either you have too much chi or you don't have enough chi. And by these different treatments that are listed below, we are trying to restore balance to your body, your mind, and your spirit, creating a sense of peace. We do acupressure and tuina, which is a type of medical massage, acupuncture, aromatherapy, moxibustion, cupping, and herbal therapy. So acupuncture, people always ask me if it hurts. And the picture on the left is a hypodermic needle with 30 acupuncture needles placed inside it. That's how thin an acupuncture needle is. It's as thick as one of your hairs. That's a great picture. Yeah. And then they are placed, and the picture on the right is a patient receiving acupuncture for a headache. So there's no pain involved. It's literally as thick as one of your hairs. Oh, sure.
We're recording this.
This is for my personal, so thank you.
Just so you know, we're recording and you'll get a link.
Oh, cool, thanks. So people ask, well, what happens when you have acupuncture? What happens to your body? There has been plenty of research, and the physiological effect of acupuncture has been proven in good, organized studies that you have a release of endogenous opioid peptides. So those are your natural painkillers. So those are released into your bloodstream and into your spinal fluid. And they bind to the same pain receptor sites as opioids do. So acupuncture releases natural painkillers that your body makes naturally. It also has an anti-inflammatory effect, and you will have an increase of serotonin, norepinephrine, and GABA, and these are known to decrease pain and inflammation. we use what is called the microsystems. And microsystems are where your whole body is mapped out on a small area. So this is auricular acupuncture, and I've always thought this is a really beautiful representation of how they figure out where the points are on the ear. It's based on a fetus in the womb.
Is this similar to the Reiki type of yoga?
No, so this is acupuncture. This is where, so the picture, the ear on the left, where it has all the different representations of the body. So you'll see the curve in the ear is where the spine of the baby is.
Okay.
The senses are down in the earlobe, and that's where the head of the baby is. The feet are up where the feet are on the baby. So they take a representation of a baby and they place it on top of the ear, and that's how we figure out where to do the point.
Okay.
And that's why it's called a microsystem. Auricular acupuncture is extremely, extremely powerful and effective. And honestly, I think that it is because it is so close to your brain. So there is a protocol called the NADA protocol. And if any of you consented to acupuncture today, that is what you were going to receive. So in the 70s, a physician named Michael Smith, yeah, sorry, Dr. Michael Smith, he was a physician in Bronx at a hospital that was doing treatment for addiction. And he implemented the NADA protocol. It's a 5-needle protocol. And now it has been so successful. The government uses it for PTSD. They use it in the military across the board. I use it in my clinic with all my patients almost because it is so effective for pain and anxiety. So there are 5 points in the ear: the sympathetic, the shenmen, the kidney, liver, and lung. So these points, like if you think of that baby upside down, those points would be where the organs would be on the baby if it was placed on the ear. So the sympathetic nervous system, that point relaxes muscles, it calms the nervous system. Shenmen is number 2. Calming reduces cravings, anxiety, and insomnia. The kidney point provides access to emotional reserves and clears blood and reduces fear. The liver point helps detoxify, reduces anger and depression. And the lung point helps detoxify and restores joy. This treatment is classically done with counseling. So it's done, you're usually in a chair, and it's done in a group setting, just like we are today. So what it does, and why it's so effective, I think, is because people will get a big endorphin release, they'll feel relaxed, their defenses lower, and it makes you have an easier connection with each other in counseling. Yes.
Does it actually work with PTSD?
It does.
If I have PTSD.
Do you want to try it?
Through the,
Do you want to try it while you're sitting here? Yeah, Dr. Gilmore will.
like,
It doesn't hurt.
If you guys knew how much PTSD I had, like it's
So give it a try. Okay. The next microsystem that is very important in the treatment of PBIs is scalp acupuncture. And you'll see the lines on the scalp. There's a line for motor area, sensory area, voluntary movement area, speech, hearing, vertigo. It's really good for treating the vestibular system. If you've lost your ability to balance and know where you are in space. It's very good for neurological deficits. If you have deficits with strength in your limbs. If you've lost, I use it all the time with TBIs and with strokes, and people can regain use of their limbs and their faculties after injury. It's not quick, but if you get consistent treatment, it's amazing how well this can work.
Oh, there's a question.
Yes.
I had a quick question. It
Yeah.
said speech. It said speech 1 was a certain area, speech
Mhm.
2 was speech 2 was a certain area, and speech 3 was a certain area. How do you determine what portion of speech you need practice on or you need work on?
That has to do if you have short-term memory, long-term memory.
Okay.
It has more to do with your memory loss and recalling. Does that answer your question?
Yeah, it does.
Okay.
I got the idea. Thank you.
Okay. Moxibustion is mugwort. It's an herb that we use. It's dried, and then it's placed on different acupuncture points. It's very good for the immune system. It's very good for pain and anxiety. It's lighted, but it's taken off your skin before it reaches the skin, so there's no breach in your skin integrity. But this is another treatment that a traditional Chinese medicine doctor will use in their clinic. So most of you have seen cupping. If you watch the Olympics, if you saw any, it's very common for high-level athletes to get cupping now. Yeah, the Karate Kid. There you go. So what cupping does, it's another way to stimulate those acupuncture points. What it does is it pulls with negative suction and negative pressure. It pulls the sheath away from the muscles, so you get this big influx of circulation to the area, and that initiates a healing response. Very good for anxiety, very good for musculoskeletal issues. You'll see pictures with cupping marks on their arms. Very common for repetitive use injuries also. We are trained in herbal medicine. When we take our state boards, we are tested on over 500 herbs in the Chinese medicine pharmacopoeia. They can be decocted into a tea, which you see on top. That would be boiled twice and made a tea. It tastes horrible. Or you can get it in patents, which are like pills that you swallow. And I have found that patients are far more compliant to take pills than drink the tea. I did my training in China, and it just was amazing to me how obedient children are in China that will drink these teas. Kids in the United States would never drink the teas, but they're very effective. So we can do patent formulas and pills and tinctures that make it easier to take. So the acupuncture points, all of the different treatments, including the herbs, are based on a patient's individual pattern of disharmony. So it's not like every patient with a TBI is treated the same way. You come to a Chinese medicine doctor and they assess you, they evaluate you, and you come up with a plan for your healing that is based on your individual pattern. So it's not like Western medicine where everybody with nausea gets Zofran. Or, right? It's very based on the individual presentation.
Tylenol, Motrin.
Exactly.
That's exactly what I gave all the time.
So aromatherapy is the therapeutic use of essential oils. Did anybody get aromatherapy? Did you give out? So let's give those out. So we brought some therapeutic oils today. They're derived from flowers, herbs, and trees for the improvement of physical, emotional, and spiritual well-being. This is why aromatherapy, ginger, nausea, emesis, abdominal cramping, anxiety, each different oil has different indications.
I have a quick question. This is not much on brain injury. I have celiac,
Mm-hmm.
so my small intestine just falls apart like really wanted. So as far as aromatherapy, I have to be careful about what I ingest.
Right.
This is not ingested.
This is
No.
just smelling.
And we still have maybe effect like.
Yeah, you don't,
Cramping and,
aromatherapy is not made to inject.
no, and so that's what I mean, it would really like brain injury, like areas of how much we just.
Yes,
Oh,
it's just smelling, and I'll tell you why it's so important and powerful.
Yeah.
Oh, did I not? Well, aromatherapy goes right to your limbic system. So
Oh.
from your nose, goes right to deep into your brain. And it's not a conscious awareness. It stimulates your limbic system, which is the seat of your emotions. That's why it's so, so powerful in treating your physical and emotional symptoms. Yes, like when you smell cookies that you smelled at your grandma's house, right? And you smell them as an adult, it brings you right back into that, like that nice space. Another way to stimulate the acupuncture points is with the acupressure, and you can do it manually with your hands, or you can do it with acupressure devices or seed patches. And I think a couple of you got seeds. It's just another way to stimulate the points. They're very good because you can wear them for like a week. We did a study at Chalk during COVID, and we did a study on, we had 3 legs. We had acupuncture, seeds, and ear massage. And it was to measure if any of these treatments helped employee burnout during COVID. We had physicians take part, nurses, everyone was eligible to take part in the study. And it was really surprising to me that what scored highest were the seeds. So people found that wearing the seeds and having them to stimulate on demand treated their burnout, anxiety, the most effective than all of them in the study. So I'm going to take you through some acupressure that you can do on yourself. And because you guys will have a link to this, you can go back to it. The first point is large intestine 4. This is a really important point for any type of pain. It is a really important point for headaches too. So how you find this point is you take your hand and you pinch in the web of your hand between your first and second bone, or in between your index finger and your thumb. And this point is usually pretty sore on people. So what you want to do is like a nice, firm kind of pinching, pulling sensation. And you can do this anywhere. If you find yourself in a meeting, if you find yourself waking up in the middle of the night with a really bad headache, this is something that you can employ to treat yourself. So this is that low-hanging fruit that I talked about in the beginning. You have access to this all the time. And the points are bilateral. So you have one point on your left hand and one point on your right hand. And what I would do is I would give it a good minute of stimulation before you switch. And then you can, after a minute, you can do your other hand and then keep going back and forth. Very good for anxiety too.
Since my brain injury, I get headaches. Can't take Tylenol, Motrin, or Excedrin.
So this
Like
is
that
awesome.
literally doesn't do anything for me. I need to take a little tiny yellow pill. It starts with a P. I don't remember what it is.
Well, you could, like she mentioned, you could start trying to do this.
Yeah,
To see if maybe
Hopefully,
that-
start trying this.
I'm gonna take a picture of this. I know I have it, but just
So while I'm going through this exercise, keep stimulating your hands. Do a minute on one hand and then flip to the other hand. And people
Michael.
are so surprised how effective this can be. I use this point all the time. I use this point when I drive. One hand on the wheel,
Yeah.
one hand on the wheel, one hand on LI4.
Okay.
Let me do that word now.
Yeah, there you go. It's very, very effective. It's called, in Chinese medicine, the acupuncture points have different names, but this is considered a source point for anything going on in your head, whether it's headache, anxiety, dizziness. This point is effective in treating it. Yes. So that bottom one, stress, yes. Okay, the next point is called yin tong. It's located right in the middle, in between your eyebrows. Okay, it's on your forehead. Like Indian women who have bindis, it's always put on this point. So you can rub it with your thumb, you can rub it with your index finger, but as we layer these points on top of each other, you're going to have a good protocol, right, to do these points a minute a piece and add them all together, and it'll be really effective. So come on, everybody try it. In between your eyebrows. Headache, nasal obstruction, insomnia, dizziness. It's very, very calming to the mind. And it's good to do some big breaths with it. If you're sitting at your desk, you can lean your head, put your elbows on your desk and lean your head into your fingers on this point. It works really well. Yeah.
All right, I'll see you guys.
So you can go back to your LI4 on your hand, then you can go to your yin tong in your forehead, and switching back and forth. The next point is called Tai Yang, and it's right where your temples are located. So right in the depression of your temples. It's for headache, dizziness, trigeminal neuralgia, pain in the eyes, and altered vision. And a lot of people suffer from visual disturbances after TBIs, and this can be really helpful for that. So nice circular movement. So now we have 3 points. We have on your hand, we have in the middle of your forehead, and now we have on your temples. And you want to give each one of these points a good minute before you switch.
Consider it self-care. Be patient with yourself and self-care techniques for your.
Few minutes to center.
Yeah, you have to invest in yourself.
Right.
Sure.
Yep.
So the next point is on the gallbladder channel. And if you reach behind your head, at the base of your skull, you have 2 little like indentations or depressions. And this point, like people who hold tension in the back of their head, in their shoulders, you can rest your hands on top of your head and reach your thumbs back there and just circle into those hollows. Very good for headache, dizziness, insomnia. If you're laying in bed and you can't fall asleep, do this whole protocol. It's so good for falling asleep. You can just put your thumb behind your head in bed. Just the pressure of your head on your hands will be therapeutic, and gently rub circles. This is a really good point for loss of memory. You know, a lot of loss of memory with TBIs. You can do this protocol if you're getting frustrated from memory loss.
It helps you getting information.
Yes.
Wherever it again, or.
Yeah. And I think when you start releasing those endorphins and your brain calms down and you let go of that stress, it's easier to coordinate your thoughts. And then you can grasp information.
that is something we know, and of course, because get stress, it's much more significant to the brain injury. But then the processing ability to stop.
Yeah.
Thought a lot of, wondered about a lot of ways to do that. I had to put that.
It's a good one, right?
Okay, so the last point we have is on the gallbladder channel 2, and a really good way to access this, it's right on the high point of your shoulders. So if you cross your hands in front of you and lay your hands on top of your shoulders, and when you rub the place that hurts, that's where this point is.
Yeah.
This is really good for neck pain, depression, anxiety. And you don't even have to do it. If you cross your hands and lay them on top of your shoulders, it's really easy. And remember, you want to try to give it at least a minute.
Yeah, like, yeah.
Okay, so we had
Good idea.
You also trained in the class therapist?
we are trained in massage. We aren't per se massage therapists,
You are trained in that.
but we are trained in massage. So we're going to go through this one more time. You'll have access to this protocol. Oh yeah, you'll have access to this protocol. So, and you don't have to do it in any order. This is it's always good to start with this point though. I have found, especially to kind of slow your brain down so you can kind of fall into it and really enjoy the sensation of taking breaths and slowing down. So start with your hands. Then you're going to move to the middle of your forehead. You can put your elbows on something and lean into your fingers. So the weight of your head will give pressure to stimulate the point. Then you're just going to move you can still have your elbows on the table and just move your hands out to your temples and rubbing circles on your temples. And while you're doing this, please, please, please be aware of your breathing. So the more that you do nice deep inhalations and exhalations while you do this, it will be far more beneficial. So as you're doing it, you can count. You can do box breathing. You can count 3 on your inhale, 3 on your exhale. Try to get into a rhythm with your breathing as you're doing the acupressure. And then you can move your hands up to your head and put your thumbs on the back of your head. If you're laying down, you can just slip your thumbs right into that hollow, and the weight of your head on your thumbs will be therapeutic. Nice deep breath. Feeling any tension in your head just fall away. Your neck relaxing. Your shoulders relaxing. Breathing. That's it. And then the last point is crossing your arms in front of you, laying your hands on top of your shoulders. And where you rub, and it's the thorax, is where this point is. Oh yeah, it's not
Thesaurus.
forest.
The forest.
Yeah, the whole time, anytime anyone speaks, does its best. But it's
I know. But at one time, he said and then said something.
Pain of the neck, depression, anxiety.
I've got all
Pain of the neck.
of that.
This is your meeting with you.
Thank you.
She rocked.
Yeah.
Okay.
No, that's delivery.
So, before we do this, does anyone have any questions about the techniques or Chinese medicine, aromatherapy? Yes.
What's the point of these sweets on the ears? What do they hit, like, what do they do?
So they relate. So going back to the auricular, map, right? Each one of these seeds corresponds to either an organ or a place on your body. And where Kim placed them, she placed them on the Nada protocol. So the first seed relaxes your muscles and calms your nervous system. The second seed, calming, reduces cravings and anxiety. People use this protocol to lose weight too. The third is the kidney. So if we went back and looked, it would be where the kidney would be on that baby, right? And that provides access to emotional reserves and clears the blood and reduces fear.
I need to.
Well, you're getting treated right now.
It needs to be like a daily occurrence.
You know, and actually, that's a good point. These things are all things you can do throughout, every day and day after.
Yeah.
So if you don't know that habit,
I know, but
you're getting it.
So without even coming to see an acupuncturist, if you'll have access to this presentation, you'll be able to do that acupressure protocol, and you'll be able to access that whenever you want. And if you do it enough, it will have therapeutic effect. Any other questions? Okay, I was going to do a guided imagery exercise if people are interested in it. Is that something you'd like to do? It's just a couple minutes.
Just ask if everyone can do a thumbs up if they want to.
Thumbs up. If you don't want to participate, you don't have to. But it's going to be a guided imagery exercise with me leading, me kind of guiding you what to do with your breathing and suggestions. It can be really helpful for any kind of pain, stress, anxiety. Okay. So I'd like everyone to get comfortable where they're sitting. I'm going to sit down too. You can lean back in your chair. You can be however you want. But I want you to check in with yourself and kind of get a sense of your body, how you're feeling in the chair. If you feel safe and comfortable enough, I'd like you to close your eyes, but you don't have to. So now I'd like you to become aware of your breath. We're going to take a nice breath in. And as you exhale, I want you to feel any tension in the back of your head, in your shoulders, releasing. That's it. Continuing to breathe. Another nice inhale, feeling your body softening as you exhale, feeling your back relax into the chair, feeling comfortable. And as we continue breathing, another breath in. And on this exhale, I want you to audibly exhale. Another good way to feel that stress leaving your body. Any constrained emotions, any anger, any fear, we're just going to breathe it out. And as we breathe, we're feeling our legs soften into the chair, our shoulders relaxing, becoming heavy almost as we go into that deep sense of relaxation. Another breath in, a large audible exhale out. Feeling safe, feeling great. So as we continue breathing, I want you to think of one little thing that you're grateful for. It can be the sun on your face. It can be someone you love. It can be a pet. But I want you to place that thought right into your heart center, right into your chest. Just put it right in the center. And take a nice deep breath in. And then exhale out. Feeling that gratitude increase a little more in that thing you're grateful for. That gratitude growing inside your chest, along with your breath, helping your neck, your back, your legs, your abdomen, your stomach, any tension you're feeling in your stomach, in your abdomen. You're going to let it go with your next exhale. And that gratitude is growing itself. It's becoming bigger. It's filling up the inside of the chest, up and down your back. And it's going up into your brain. A great sense of gratitude for being here, for all the progress you've made. And the next nice breath in, and then big audible exhale out. Feeling so soft and comfortable in the chair. And feeling any sensation in your body, letting it move, letting it be comfortable. And when you're ready, you can kind of come back and open your eyes. Think about what you were grateful for. Take a big breath and exhale. Excellent. So that concludes my. We are going to leave some cards. We have a clinic located in Orange and one in Aliso, Viejo. I don't know why that's not reading. So when you get the contact to this, you can see our phone numbers on there. If you have insurance, you can call my office and give your insurance information, and we will run your benefits and tell you if you have coverage or not. I have a Cal Optima contract, so a lot of people have Cal Optima. That's actually a really good policy to have for acupuncture. So it was really nice to meet you all and all of you at home, and I hope to see you in clinic. You're welcome.
Thank you very much, Doctor.
You're welcome.